people signed up for today, so we're quite excited. You'll note that the recording has started of the session, and that's so people that couldn't make it today but have registered, we will share the recording with them and yourselves as members. So there's some useful links while you wait. And if people are tweeting, that would be great to see, and do tag us in. You can see our handle there at everychildnenc. You'll get these slides at the end as well. And so you'll see the links to the website, and that QR code bottom right is the one that if you're not already a member, then please do encourage, register yourself and encourage colleagues as well. And then they'll receive our weekly Child Health Tuesday newsletter, and then you can find out about all the different events, or if you've got things you want to share with us, we put other people's news in it as well, and it goes out. So Mel, I'm pleased you joined us. I know you had some IT issues before, so great you could get online for this, and great to see Amanda, one of our creative health champions, is online and seeing a real breadth of different practitioners. So we're just coming up to 10 o'clock. People that are just joining us, do put in the chat who you are, and we encourage you to use the chat throughout the session. But we want to really maximise the time that we've got. So if we take it to slide number 4, if we can, Carol, thanks ever so much. And we will kick off on time with everybody on mute if they can, so we don't get any background noise, which is great. So welcome everybody. My name's Heather Caller, and I'm delighted to welcome you today to our huddle. Before we start, and I hand over to Martin, who's going to chair the events, we always give the background of our Child Health and Wellbeing Network, so people understand where we're coming from and how this huddle fits in with the rest of the work that we're doing. So some of you may have seen these before, but some of them are new slides as well. So the first one is on the context of the North East and North Cumbria. So some of you might work very locally in a specific area or with a specific vulnerable group, for instance. We cover the North East and North Cumbria, and children represent about 20% of that population, and the poverty levels, as many of you will know, are extremely high, the highest in the country in many cases of our local wards. And that's what drove us to want to do something differently, because often when we're working into these communities that have got multiple can we just go on mute, please? Thank you. So they've got multiple challenges, and so the outcomes in those areas do not mirror the outcomes from people in the less disadvantaged areas. So that was one of the things that inspired us when we first met to work together. So thank you, Carol. If you want to just pause slightly on the next slide, but then we'll go to the one after that. I just want to highlight the arts and creativity has been part of our journey since 2018-19. We had our first workshop in 2019 that resulted in the STAR innovation that you can see on the picture on the right there. And you can see on the next slide, which shows you the priorities that were given by the system. So we wrote out to the system to say anyone working with children and young people themselves and their families, let us know what we should be working on. And so that's what this is built on. And we've had over 2,000 responses. And you can see the bottom right there was a cross-cutting theme, arts and creativity. And all the network, and the network isn't an organisation, it's not a thing, it's a network of partnerships, and it's to deliver on our shared vision that you can see there. It's about working together across organisational boundaries to enable more young people to thrive. So something like working into culture and creativity with health is one of those such partnerships across organisations that sometimes would sit separately in their silos. So thank you. On to the final slides here. So there are some of those shocking statistics that I mentioned earlier associated with some of the outcomes in our area. And it just shows that a lot of those statistics are up to date from this year. And it still holds true that those priorities are of key importance to us to tackle in our region. And thank you. On to the next slide, and that's the proportion of young people in our area is 20%. You get these slides, you can look back on them. The next two slides introduce some pieces of work. This one has a link on the bottom left that you might be interested to look at afterwards. It's the facts of life in the North East and North Cumbria, and it's what we call fingertips data. So it's public health data on the young people in our region. And we had some fabulous people up in the Northeast Observatory that calibrated all that data, brought it all together and did a summary in our facts of life. And you can see the chapters there, and there's a link, and it's done per region. So if you wanted some statistics on mental health in young people in North Cumbria, you can go and find them in that document. So hopefully that will be helpful. The next slide shares some of our delivery and reach. So you get an example. We work with a lot of advisors. Martin's one of those. We've got a youth board that's very active. And if we go to the next slide, our youth board that are called Know Our Impact Group created a manifesto for us. And they were first. This was before the election. And their manifesto has those 4 key areas. So children and young people in our priorities were centre and to that. And it comes through in this clear manifesto that we're working to in the network. And then finally, I just close on some words from Sir Al Ainsley Green, who is from the North East, and he was a great advocate of ours. He was the very first children's commissioner, and this is from one of his books, and it just helps us to highlight the importance of children and why we should celebrate them and their contributions to society, because there's lots of injustices and we need to shout them out from the rooftops to expose them. And if we don't, who will? So I will just leave that there. And if there's anything you want further on the network, we will be putting links in the chat. We've got a generic email address as well. So do get involved. We've got other events, or there might be things that you want to share with us. So we're really excited to find out about that. And I'm delighted to be here with my colleagues, Carol and Amelia from the network as well today. So over to Martin. So we're delighted that Martin's going to chair our session, and he is importantly the Executive Director of Tin Arts, but perhaps slightly more importantly for us, he is our Arts and Creativity Advisor for the network, which means he has a small amount of time that he puts aside each week to help us advise us in this area. Martin's worked in arts and culture in the North East for over 25 years, although we don't think he looks old enough. Tin Arts delivers activities across the North East, and their vision is to create a world in which everyone has access to the arts. And I think I will leave it at that point, which I'm sure resonates with us all, and I'll hand over to Martin. Thanks, Martin.
Thank you, Heather, and hello and welcome everybody this morning to the Huddle. So yeah, I am the Arts and Creative Advisor for the network. Essentially, that means that it's my role to look at how we can bring health professionals and the cultural sector together for the benefit of children and people across our region. And it's all about creating the space and the methods by which to develop conversations, dialogue that hopefully can lead to change and actions as well. Obviously, today we are looking at how we might best build a skilled and resilient cultural workforce to maximise benefit, particularly for children and young people. But at times we might well talk about the wider population, because much of the cultural workforce and much of the workforce in across the system might well work across age boundaries and aren't specifically just for children and people. Throughout 2024, there's been a range of conversations, some quite small and intimate, and some being quite larger. And today's Huddle is the next step along that journey, I guess. So it's great that so many of you are able to attend and join us today. There's definitely a lot of evidence and a lot of anecdotal conversation about how the creative health is growing the field is growing, and actually, as somebody who kind of has some national connections, there's a lot of it in the Northeast. We're doing great stuff in the Northeast. There's a lot of pioneering, leading work, but there's a slight danger that we could end up with a growing creative health sector, but we haven't got the workforce to grow and expand with it, and to kind of diversify and flex to what we need going forwards, and the skills and resilience that come along with that. So that's why today's question is very much focused on how might we build. So we're going to look a little bit about skills. We're going to look at resilience as well, and have a couple of speakers on that. And then we're going to think about wider about how we actually might build this together, and what a collective approach might be for the benefit of the Northeast in creative health with children and young people. We're going to start today. Sorry, I'm also getting text. Sorry, I'll Heather an email. I'll text you in a minute. I'm getting a few texts from people who said they can't quite get the link to work. So once I've set people away, we'll have a look at why some people aren't quite being able to connect in.
Okay, thanks.
That's why you shouldn't wear these phones and watches that tell you stuff, and you keep getting distracted by them. Okay, let's start off. We're going to start off with a little round of challenges presented by people from across the system we've invited to give us a very quick 1-minute snapshot of 3 challenges, which can kind of help us frame today's conversation. We have 5 presenters who are going to give us some quick challenges, 4 of which are here and 1 of which is text. Oh, Alice, I think, is here as well, actually. Now. So can I invite Catherine Hunter? Catherine, could you be able to take yourself off mute and just talk for 1 minute through your 3 challenges that you're sharing with the room today for us to consider as we go through the morning?
I can. Good morning. My name's Catherine Hunter, and I'm a family peace supporter for parenting with Harrogate and District Foundation Trust, and I work in the south of County Durham. So the challenges I see are, how do we raise the profile of creative health interventions so they're recognised as a solution to our health needs, not just a nice add-on? And this is about how do we educate the wider workforce about the benefits and the growing evidence base that we do have on the protective and preventative benefits that creativity brings, so that solutions are valued from the creative workforce. Whatever sector we're in, we're all doing more now with less funding. So there's a challenge around how do we secure funding to deliver creative health projects, but actually about accessing funding to train staff, which would allow organisations to collaborate together and share the skills that we already have. And as Martin mentioned, there is lots of brilliant work happening, but we often work in silos. And I think especially when we're government departments, our agendas are changing all the time. So one of the challenges for me is finding out what's happening in our communities already so that we can build our networks, share our expertise and work together to develop some long-term plans for the workforce. And that's my 3 challenges.
Amazing. Thank you, Catherine. That's brilliant. And if we go on to Kaylee Kirtley. Are you there, Kaylee? I'm just going to look at the attendee list. I don't think we have a Kaylee.
She's just dialing in.
Okay.
She's joined us this moment.
Okay.
Kaylee?
Well, well, to give Kaylee a moment to settle, shall we? Wendy, Kelly, would you like to just come on and do your 3? Then we'll kind of split backwards through the slides.
I will, and I've never yet made a minute, but I will try my very best.
It would be a personal best, but wonderful.
Good morning, everybody. My name's Wendy Kelly, and I'm the South Tees Public Health for Children and Young People's Emotional Wellbeing. So my 3 challenges for creative health is that, you know, a lot of our existing workforce have got skills and knowledge relating to creativity, but how do we upskill them to better deliver on the health agenda, really? Who do we link them into to make sure that their skills can be used to improve outcomes for our children and young people? Sustainable funding. Often creative health projects are due to grant funding, which is generally short or medium term. So how do we look at sustainable funding streams to make creative health a real impact across the system? And being involved in the Chris Drinkwater Creative Education Awards, we had some fantastic projects, but often the outcomes, the health outcomes, were not particularly evidenced within the submissions. So how do we use a range of recognised metrics to evidence the benefits of creative health, which then will have an impact on the funding? That's my 3.
Great. Thank you very much, Wendy. I think that was a minute. I think
Was it?
gold,
Yeah.
gold star. Well done.
Minute that, please.
If it's okay to go back one slide. I had trouble. Okay, so we're still struggling with Kaylee's connection. So let's go forwards a slide, which will bring us to Alice Thwaites. Alice, are you able to take yourself off mute and share your 3 challenges? Okay. This could be quite a technically interesting session this morning, couldn't it?
Alice has
Whilst
come off mute, but we cannot hear her. But I've checked on the list and she's not muted.
yeah,
Technology.
We will. Alice, thanks. We'll work out what's going on. Cheryl. Cheryl, we can hear you and we can see you. That's amazing.
Morning, everyone. I'm Cheryl, Director of Helix Arts. Few hats. I'm also the North East Regional Champion for Cultural Health and Wellbeing. I'm a woman in my 40s with my scarf on in a cold big room in front of 2 big globes for anyone that needs that access description. So my 3 key challenges won't be surprises to you. To flourish the things that you can see on the screen, care for wellbeing across the freelance workforce is coming up in a lot of the conversations, specifically around the things that maybe more structured, systematic organisations take for granted. So around clinical supervision in settings such as homeschooling, care for young people, and thinking about the lens of trauma in that work and readiness, that readiness for self-care, as well as what specific things are organisations putting in place. Then that training and access fund thing that isn't a surprise, but what the conversations that are coming up is just more joined up training. There should be that checklist of like non-negotiables if we are really committed to working in creative health. The practitioners are supported in a certain way, and what's the funding model behind that, for organisations. Capacity always comes up and it's weaved in relation to training, but it's actually what's the role of the broker. So like Helix Arts or Mortal Fools or Blue Cabin, like what things can we put in place, what things are one-off and what are more regular. So lots of things around how do we implement really strong networks that are supported financially, but also supported between the networks. So that kind of in-between land, between projects, who's looking after the workforce then. In some recent conversations is actually getting cross sectors in the same room, and how do we really do that? So it's probably the thing that will hack the day, hopefully. And that's it. Thank you.
Amazing, thank you. Brief but very concise, and a lot of thoughts and considerations in there. Let's flip around and see if we can beat technology. So, Kaylee, do you think we might be able to get you off mute and online? If not, then I will read Katie's slide, although I'm sure everybody's able to read it because I'll just be literally saying what you can see in front of you. Okay, I don't think we're going to get Kaylee through, so that's okay, Kaylee, not a problem. I will just talk to your slide and just unpick a little bit. So there are a few things in here. So first of all, we have workforce, demanding job and increasing external factor, adding extra pressure such as cost of living, less support for families that historically, more grandparents having to work rather than help with grandchildren. So I suppose it's just about the balance between working and life and all the pressures that surround everybody at a time when there is certainly cost of living, and we all suffer and are all part of that. So that's definitely thinking about the workforce and how we support them in that. And then there are other things like cost of nurseries and childcare, which is that balance about how much you return to work and how much you stay at home to care for. So it's actually, can we keep the workforce available and present, and as the creative health sector grows, can we grow the workforce, or are we going to struggle to get past some of these barriers? And students have returned to school after COVID with a lot of anxiety. Students have also accessing the community in a lot of groups. This means a lot of our students only spend time at home in school. And this is as a broader cultural kind of comment, we definitely have seen a struggle with attendances across activities in lots of cultural programs that we are part of. I'm going to assume that's across the same in many parts of the system and youth sectors, but young people certainly came back from COVID making decisions about what they would do and how they would do it and where they would do it, actually. And the resilience to engage in face-to-face activity has dropped in some areas. So that's some part of it. If we flash forward to Alice's slide, and again, Alice, I think you're struggling with, you're off mute, but we can't hear you, I'm pretty sure. So there are 3 of the slides in front of Alice. I can tell you. There are 3 of the slides in front of Alice, and we have talked a bit more about these, so I can hopefully talk a bit more. The health workforce would benefit from understanding about the benefits of creativity to health as part of training. I think this talks to what Gareth Cheryl was saying before about the constant collaboration and conversation, understanding, building understanding about what people do and how that works, and the diversity of that. We have loads of cultural practitioners and organizations in the room, and we all take a very diverse approach to how we use creativity to engage through health benefits. There is no one way of doing it. So I think that broad understanding through art form and through ways of engaging culture is really interesting. If you are interested in pursuing a passionate career in arts, then you generally would go through degree courses, and actually creative health is not really present upon those courses at the moment. In fact, actually, education and pedagogy is quite small in many of these courses. So there is a way of thinking about how do we work with higher education to raise the profile of creative health as part of that work, as part of the portfolio career that people might adopt. And need for more support for cultural organizations, freelancers to offer ongoing continued professional development. And that's huge. And as again, Cheryl said, and other people, it leans on resource and capacity and funding to enable this to do this, but also being able to access the right people who can support us through those conversations and provide that information, advice, and guidance. So that's a lot of challenges. And I think it's fair to say we might not pick them all apart and get through them all in the next couple of hours, but I think they're all really great salient key points to be holding on to consider. So what we're going to do now is move on to a couple of presentations. So if we flash forward, I'm going to confuse Carol and Amelia slightly by asking if we can go to the second presenter, please, which would be the next slide along, which is Jenny Young from Blue Cabin. So we're going to start off looking at resilience. And Jenny was very kind because she couldn't attend today, that she did a pre-record with me. So we pre-recorded her presentation to the room. And we also have Jane Gray with us from Blue Cabin, who might be able to add or contribute or ask any, respond to any questions and answers that might come after Jenny's presentation. I've got a very quick bio of Jenny. She is the director of Blue Cabin, over 20 years experience working in both local authority and cultural sectors, and has extensive knowledge and interest in care experience communities. As part of her presentation, she will talk a little bit more about who Blue Cabin are and what they do. So I will mute myself. This is a 17-minute long piece of presentation, and enjoy listening to Jenny for the next 17 minutes. Thank you very much. How do you move on to a slide? You do. I don't know who's listening to a lot of country music. That's not my playlist, I swear. Thank you very much to Jenny for pre-recording that with me. A couple of things to kind of share back. I've spoken to Jenny lots, and I've known Jenny for years now, and I wanted to make sure there was a platform by which Jenny could share the work that Blue Cabin do around resilience, because our conversations go on for quite a long time. We talk around this quite gladly, happily. Blue Cabin have they put a lot of care, time, and attention around supporting the workforce. And I think there's a lot of, and I think as Jenny says, they've discovered their approach, and they've discovered their approach by talking and consulting and liaising with other people. The approach that Blue Cabin take isn't necessarily the right approach for everybody, but the key principles that sit underneath it, which was about understanding what resilience looks like for Blue Cabin, but also the second question, which is quite understated, but well, and how do you know that? How do you know what resilience looks like for your organization and your workforce? And there's clearly a lot of conversation, and there's clearly a lot of peer-to-peer support, and it's modeled across the organization. And I think that there's lots of things that came through that, and hopefully you'll have picked out your own parts as well. But there's that always comes back to me. And the bit that Jenny says towards the end, which really chimes with me, is trying not to work at the edges, because it's working at the edges where resilience becomes challenging, and where things become quite difficult, and taking that time and modeling with our peers. So, talking of resilience and being able to adapt to situations, our second speaker is no longer able to join us this morning. So with a flexible and adaptable approach to think about how we solve this, we've quickly asked a couple of people to make themselves available to talk to the other piece of work we wanted, which is around skills and or whatever their context might be in creative health. So we don't have a slide for Mel, but Mel from TWAM, are you able to take yourself off me? Oh, there you are. Hello. Mel very kindly has offered to just talk a little bit quickly about skills, and then we're going to ask Cheryl Gavin from Helix also to talk about the work of Helix Arts and Creative Health. Mel, are you okay to fire away and just share some thoughts with us?
Absolutely. This is going to be a slight brain content download, so let's see what comes out. Morning everyone, I'm Mel Burgess and I am Programme Manager for Regional Cultural Learning here at Tyne Wear Archives and Museums. We work with the network and with Martin on the creative health work, and our focus is around developing those partnerships between the health sector and the culture sector. So that's what I've been having a little think about in the last couple of minutes since I found out I was going to be talking to you. And I've just been thinking about those partnership skills really, because I think that's really at the centre of all the creative health work that we do. It's really rare to find one individual who has got the skills, knowledge and experience of both the culture side and the health side. So really effective cultural and creative health work is all about that partnership work and those skills that are needed for that. So the first thing I was thinking about was that ability to start to understand one another's sectors and to listen and learn from one another. The navigation of both sectors is really different, and it can feel really murky trying to step into how things work on the other side. So from my perspective, coming from the cultural side of things, kind of figuring out what's what in the health sector and who does what and how is everybody connected and who do you speak to that will connect you to the different people is quite challenging. And I know that for the health sector then it's the same on the cultural side. We've got organisations of all different sizes and scales and freelancers, and how you navigate your way around that process is really tricky. So really that skill to kind of do some of that research, but also have those conversations and just be content with those conversations that aren't necessarily let's plan a thing and do a thing immediately, but let's understand each other a bit better and let's talk to one another and just begin to work out where the overlap is, and finding that middle ground. We're not so different. We have really similar aims, and it's finding out where that overlap is and how we can support one another to achieve those end goals and the things that we really want to do together. I think as well, it's about that recognition that we can't do everything as an individual, and who's got what expertise. So culture sector workers are not healthcare professionals, and healthcare professionals are not culture sector workers, and that is absolutely okay and totally fine. So understanding what your expertise is and where your limits are, where your boundaries are, is really important. Knowing how to work to your strengths and knowing who you need to work with to fill those gaps to create a more well-rounded piece of work is crucial. And then leading on from that, the kind of thing that underpins everything is always communication, and assume nothing. The one thing that I've learned through all of my cross-sector partnership working is that we're not ever speaking the same language as anybody else. And quite often we're saying the same words, but they mean really different things in different contexts and different sectors. So don't ever assume that if you've used a particular phrase and you're talking to somebody outside your sector, that it means the exact same thing where they are, because I have fallen foul of that many a time, having a conversation about what I thought we were both talking about the same thing, and we were not at all, because it meant very different things in different contexts. So always coming back to that language and finding the common language and the common ground. And yeah, no assumptions. And then finally, always remembering to take care of ourselves, no matter what our role is. And Jenny just talked about that a lot, the importance of supervision, knowing who we can talk to and when. It links back to that idea of not trying to do everything on our own, but continuing to have those conversations, making sure that we're thinking about our own well-being as well as those of the people that we work with. And again, knowing when we need to step back, and always coming back to the question, what is our expertise as individuals, and where do we need to hand over to somebody else? I think that is everything that I have come up with in that brief period of time, but I'm sure that Cheryl will have more thoughts.
That's fantastic. Thank you, Mel. And again, in your short, improvised, off the cuff way, there was loads in that. And I think reiterating that resilience is for everyone and not just for others. It's not the job of us to go, well, we'll make sure our workforce is resilient, but that doesn't count me, because do as I say, not as I do. And like I said, work there. I think it's really great. Definitely agree with language is crucial. And there's a thread line through what you're talking about there, which felt like if our conversation should be consistent and continuous. This is a bit more of a marathon than a sprint, and steady progress is absolutely fine. And we don't have to try and get everything done as quickly as we can. I really appreciate you contributing there, Mel, and jumping in and helping us. And then I also massively appreciate Cheryl, who's also going to jump in and save us. And Cheryl, you are going to share some slides from your device, which you should be able to do, if that's okay.
Ooh, right, bear with us. Let's see. Now, if I can't see you, you're just going to have to shout it as if you can't see anything, because Teams has got that lovely hiding tabs function. Right. I'm just going to switch to the viewers. Can you see my screen, or can you see me at the minute, Martin?
We can see Helix Art slide with Cheryl Gavin, regional champion. Yeah, we can see
right. That. So for the laughs of the room, these aren't in any particular order, but I've got creative, and we'll see how we'll go. So I will just leave this slide on, because the many hats sometimes merge. They should merge, shouldn't they? And one of the things that I guess Helix does, or tries to do, is they see the whole human. So that starts in lots of places in the organisation. But I've just chucked this slide on because we have some really simple things that we do within the team and outside of the team. And this slide demonstrates like one of our away days when we were just adjusting our values, you know, like when we work with the freelance workforce, we're obviously setting these project teams new all the time, and we might not always think about the same principles as setting up more permanent teams. So that is something like Helix is trying to do a lot more, thinking about what's this mix of people that we've brought together. And on this slide, we're just kind of hashed it out, like what are we doing internally that we need to ripple into our projects. And I mean, some of it resonates like immediately, you know, in the moment you might see these things about like caring feels like something that everyone should do, but we don't do it so well when we're stretched. Being reliable, being honest. So some of this thinking over the last few years has fed into how we work with our freelance workforce, and the practical things that we do in terms of care include, I'll move on to this one, include thinking about all the different types of people that we're working with, and knowing that the workforce is also representative of the people that they're working with. So if we're thinking about, say, an artist that's working on one of our schools programs, we might try and understand what their lived experience is a little bit enough, you know, in the induction. So all of our artists kind of get a welcome pack, they get an induction appropriate to the level of work that they're doing. Sometimes we miss stuff where we think that's what you need to know and we'll ask what they need to know, and we miss it, but that's constant learning in the organisation. We also consider like the breadth of work that an artist does. So if they're working on, say, a one-off residency versus a long-term programme, cutting across our creative health work, I mean, in honesty, obviously we become more important to each other, don't we, in terms of relying on one another between kind of a freelancer and an organisation. So that level of, I guess, associate, that's kind of what we're developing, those tiers of working with different people and being dead honest about what kind of information and support people need. And a lot of that's around better communication. So we've changed a lot of our communications in the visibility of care, I guess. So just why do I care about this? Like, why do I care about the workforce? Helix has always done arts and health work, and obviously the labels and descriptions of this arts and health, arts and prescription has changed. And our last MPO, we were really like fighting for this stuff that we're doing, and we need more of it. So we're a bit demanding. I think one of the things Helix does for artists around care and wellbeing is trying to be demanding with some of the structures and systems. So we can't deliver a core creative health offer like the one described and achieve all these outcomes if we don't do that for our workforce. And this is across a lot of different types of people and groups, young people and groups. So I've got some examples later down. I don't know where I've put it. 1 second, I'll just whistle down. So some examples of the kind of things we do depend on what they're doing and who they're doing it with. So Better Connect is a core program, and we're trying to develop a bit of a checklist. So I'm speaking to other organisations, like, what can we come together with in solidarity? And we'll be like, our checklist is all of our artists are first aid trained, mental health first aid trained, a level of clinical supervision, what's realistic, who can we access, who are the right support organisations. The other things I guess we do is we've got a quality framework which has reflective practice built into it. So simple things like artist diaries, but actually not asking for that information, then not looking at it. So quarterly we'll review all of those and like make changes around what support we're doing. And because we've got funding for Better Connect specifically, we can go a bit harder, you know, in terms of expectations of our staff team. So I think people think sometimes care can be kind of soft, and it is, you know, and it's supportive, but it's also like making sure we meet people's expectations as well. Another example, one is way back in the archive, it was around Action Story. Young people in that project had various learning difficulties, neurodiversity, complex needs, and they were working with artists long term. So a lot of that information, sharing, narrative, stories about their lives and their families came across. So I had to support artists. We didn't call it trauma informed then because it was so long ago. Obviously it was that, but it feels like we put those structures in at that time to really understand like what's the growth curve of all the people involved. And that was about transforming CAMS services. So we were able to lean into the health partners where their specialism is and bring our kind of participatory arts and health specialism. So accessing the mental health services that are in the programme for the workforce. Story of Place is a schools programme we did during COVID, post-COVID, and that was looking at the care and resilience of young people. So actually we ended up supporting teachers more in this, and I think that's the thing that we can do really well is think about the partner support to be an effective partner for it. So although the freelance workforce includes artists, for us it also includes the youth workers and the support workers and the social care workers. So for this one, we developed a range of like resources and training, and another artist who had experience of that, Leslie Guy, shared that, and it leaves that legacy so we can build that into future induction programs and training programs. One more example would be Louder. We know that when we're working with young people that is specifically issue based, so this is around domestic violence, that we can't take for granted that things will surprise her. So this was a partnership with Mind, where we thought actually there's lots of supervision and structure there, but there wasn't a lot of agility and kind of weaving to be able to respond to what comes up each week. So we put a few things in place, so extra supervision, but also an intimacy coach for the content that was being created, so for that process, and then the ripple, like when we released it to schools and what support teachers might have needed. So then we worked with the local authority in terms of that welfare and the support staff in schools. So they're kind of practical things to do with the project. The bigger things that we're doing, which sometimes get missed, of like, why are we doing all this strategic? Why are we sitting in this room? Is to achieve some of these things. So like, can we influence the health sector to support the creative sector more, and vice versa? Can we influence decision makers? I know funding's come up a lot in capacity building. Can we make those, well, Helix is making those shifts, nudging people, trying to better understand the system so that other people can just understand what they need to understand. There was a recent creative health forum that I spoke to, in like the flash for me was people, like individuals and freelancers, need to know the right amount of information to enable them, and like, what's the starting point, what's the long point, you know, I'm really experienced and what do I need to know now, and trying to keep up with that. So some of the work we're doing is looking at that, like I think Jenny had described it as well, like how we deal with participants, that lifelong experience and career long experience is important for us. It's coming up a lot where, like, how do you get your foot in the door, like any career? So this artist associate model that we're trying to develop, and having conversation with other organisations, so Ben was one of them, to go, right, well, what are you doing, and do you do that really well, and what are we doing? We do that really well, so we can take time to think about what does 2030 look like for our workforce. So I'm always doing this thing of like, we're 15-year-old now, we'll be 20, so we're talking to the 15-year-old, you know, in our development work to create the structures further down the line. I think, yeah, they're probably the key points. The other things, I guess, is awareness of like, what is good and what is caring feel like for your organisation, which obviously Martin had summarised from Jenny's, that me doing Helix, doing a welcome and induction and supervision and reflective practice is what works for us, in which bits are going to work for you. And an example in that that we're seeing through this is the quality framework as well. So I don't know if you do or do not know much about this, but the National Cultural Health and Wellbeing Alliance created this toolkit. You won't use it all, but it's worth us some principles, you know, to check in. So we check in with these. We're piloting on with creative health, and this is a conversation that we're going to take to what we're calling like a creative table for artists, and just see where it goes. I think there's a little bit of we're like elongate things, so we're doing a bit of minimal viable product, like, is this needed, is it not needed, what does it cost, what will we do with it, does it make change in the long term? So yeah, I think that's it, Martin.
Wonderful. Thank you very, very much, Cheryl. And again, we've had many conversations and spoke loads, and again, it's great to get that platform so people can hear more about your stuff. There's a lot you said, and I think what's really interesting is also the retention was a word you picked out there, which is actually, it's great if we can build a workforce, but how are we going to retain people and stay into that workforce? Because we can only grow it through that way. I particularly also would heartily recommend anybody looks at the framework. There's a lot in there. No, this is great. Thank you very much, Mel and Cheryl, for responding to that. We are about to head into a quick break. A couple of quick things. We are going to resume at 11:05, so you can mute and turn your cameras off until 11:05. Heather will pick up the conversation after then. The conversation will be focused around a range of things, but really it's about gathering your thoughts, reflections, and observations, and information you'd like to feed in. And coming back to that, how might we build a collective approach to a resilient and skilled workforce? There's clearly a lot of great activity happening, but this is about moving away from that silo building and making it a collective approach to that. Actually, and that's the key stuff we'd like to kind of unpick. There's lots of really interesting stuff in the chat. I'm pointing at the chat. I don't know why I'm pointing there. I recommend going back and reviewing the chat, because it's quite hard to listen and read chat all at the same time. And keep things coming through the chat, particularly if you are health, education, local authority. Your views, throw them in there. Let's try and build that kind of diversity of thought approach across there as well. So we have 6 minutes. So see you back at 11:05, and Heather will pick up the thread from there. Thank you very much. And again, thank you, Cheryl and Mel and Jenny, for all your contributions.
Thanks, Martin. We're just on 11:05. Carol, on my screen, I can see the sort of screen sorter page. There we go. Lovely. Thank you. Shall we take it on to the next one? And do people want to pop their cameras on so I can see some faces, and I know we're all back from that break? Just some fabulous discussions. Yeah, I've got a thumbs up. Thank you. That's helpful. Can I see a few more thumbs up if people are with us? I know a few people have had to pop off. Thank you for those. Hi, Mel. Ah, lovely. I don't know what the collective noun is for thumbs ups. Okie doke. So off we go with the next part of this, what I'm finding most intriguing session. So we had great discussion in our first hour, and I think great sharing by Martin as well, and showing us that flexibility and resilience, as he said. In the next 30 minutes, what I want to do is encourage discussion, which is always quite challenging when we're all sat in different locations. We need to create this sense of us and make sure that we're not shy to come off mute and join in the discussion. And then after that wider discussion, we'll have some reflections again from the fabulous people that have already highlighted their challenges, and we've got some examples of that. But then at the end, it's about defining what that collective action might look like. And so seeing if we can pull it back at the end into some kind of agreed action, because actions do speak louder than words, as we know. So how can we progress it? And I can heal the real passion and experience and interest in this area. But it is challenging, and we've heard those challenges. So how might we make those baby steps forward? So first of all, and I know myself and Amelia have been trying to follow the chat and the discussion, and I've got some threads that I want to pull out, but I want to open up. Please continue to use the chat and pop your hand up if you want to talk, and I will use that and engage as many people as I can. But I want to enable people to vocalise some of the comments and the questions that are put in the chat. First of all, I just want to come to Alice, because she was one of our original contributors who had challenges with her IT, but I saw you went off and came back on, Alice. I just want to find out if you're now able to share your questions yourself and your comments, or if not, I will articulate some of those. No. Okay, I can see you're still not on mute, Alice. But no, the mic still isn't working. Okie doke, I will pop back to chat. But in particular, Alice, in her role and the national perspective, we've got some valuable feedback she's shared over in Northumbria University. Some of those roles, those critical roles within health, are now actually going to have placements out in creative health organisations, which is fabulous. She highlighted the importance of space to reflect, and I know Bronya in particular had highlighted that as well. And so I don't know, Bronya, shall I bring you in on that space to reflect? We've heard about some of the practical tools to do that around reflective practice, around, I suppose that could be included in the induction pack programme, more formally through therapeutic supervision and elements like that. So Bronya, do you want to share your thoughts on the importance of space to reflect?
Yes, I can do. Thanks for bringing me into the conversation. Obviously, I come from a sort of research background, and I've been involved in a project where we've been exploring supporting people who are in the community, working with babies and their parents to support their relationships. And obviously, I think it's recognised that the best person to provide support for a new parent and their baby is whoever that parent has a good relationship with. And that might be somebody in a sort of health setting, cultural organisation. But the issue then becomes that who supports that person, who's providing the sort of direct support to the family. And so we've just been exploring providing supervision for people in different roles, providing support, and then that's a sort of national level, or alternatively there may be local supervisors, but those supervisors may need more sort of national supervision, if you see what I mean, because even those people who provide supervision might actually need time and space to reflect as well. So it's just been really interesting to be a part of that. We don't have sort of results on that we can sort of publish at the moment, but it looks really sort of interesting, and I do think it is valuable for people to have that sort of time and space to reflect. But obviously I know obviously everyone has challenges around sort of capacity.
No, fabulous. Really interesting to hear that. And I think you've spoken about the supervision. Are there any other elements that fit into that broader support? Any other things that you want to mention? Or is it just focusing purely around the supervision element?
I mean, obviously, I think, you know, there's been sort of things around sort of trauma-informed approaches as well, and just always making sure that we're taking care of everyone's well-being and recognising that we may not know what people have experienced and what conversations might bring up for people, and just being sort of really sort of responsive and aware of things like that. Yeah.
Lovely. Thank you. And it's nice to see in the chat we're getting suggestions of how the mic might work for Alice there as well. But thank you, Bromnia, for that. There was also, I'd like to bring Kiz in. You'd popped a few bits in the chat, the importance of the sort of more permanent contracts and the model that you've used to ensure that the staff that you have, you're developing those skills and the learning. So would you like to come and share that with the group?
Yeah, sure. Thanks, Heather. I think for us, it's important to say we've been on a bit of a journey with this. So we've tried a number of different approaches over the years, including some that some of colleagues at, you know, Blue Cabin and other places have cited. For us, I think it was a process of, we used to work with predominantly freelancers in the delivery spaces, and we were finding that actually it was a real challenge to build up those ongoing relationships with them, to do the level of support and investment that was becoming increasingly important for us to look after those staff members' well-being, but then also to equip them to be able to do that for the beneficiaries that we were working with. So we tried a few different models, but where we've ended up settling is actually saying, okay, so what do we need in terms of a delivery team within our organisation? Where we're at the moment, I popped in the chat, but just to reiterate, is we've got 3 full-time members of the employed delivery team and 1 who's 4 days a week. And then we also work with a series of people who work in more sessional ways. So they're on fixed term contracts, really, as well as then specialist freelancers that come in specifically from project to project. And having that structure works so much better for us as an organisation, allows us to deliver to a higher quality with our beneficiaries and have those higher level outcomes for those beneficiaries alongside actually what we're able to do for the staff team. And I think a key success factor in that I don't think we've mentioned, I think it's sort of been alluded to and touched on a little bit in the conversation so far, is actually the importance of how we cultivate a shared culture within organisations that should sit across all areas of an organisation. You know, whether you're core team, whether you're freelance, whether you and across all the beneficiary delivery spaces, it should be evident in our partnership working across all areas. So one of the things we found that's been super successful for Mortal Fools has been the really investing in the development of an organisational culture that has care, that has well-being, that has peer-to-peer learning, support structures, ways of working, almost down to every last interaction. And when we've invested in all of that foundational principles, we're finding that we have been able to respond much more readily, much more effectively, and much more safely where staff wellbeing is concerned, to the ever-changing needs that we've got with our beneficiaries and the different contexts that we're working in. So yeah, I mean, that's something I'm really happy to talk to people about if that's useful. But yeah, there's a number of different success factors, and I wouldn't be surprised, well, in fact, I'm certain that, you know, in a year's time, we will have evolved this thinking even further, because that's how it should be, because, you know, people change, learning grows, etc., etc. So all of the things that we are constantly getting in terms of training and so on should evolve these things, but it's got to be centered around that core organizational culture, like I said, that then it should be evident across all of those different settings.
Mm-hmm. Thank you. And I just wanted to ask if that resonates with other people as well. And I can see Martin's put in there that it's a really key point, and it does sound fundamental. If you've got a stable workforce, then all the intervention and support you're giving can grow and can develop, and then can support the new workforce as that comes in. And I suppose that sits alongside some of the other suggestions that I jotted down that different people had mentioned around the therapeutic supervision, around mental health first aid training and first aid training, around reflective practice, around the induction pack and the induction program and the Wellbeing app. All of those kind of piggyback on the more consistent workforce that you're sharing there, Kiz, I think. So I'm curious to, I think we have seen part of this Gloucestershire Creative Health Consortium. Unfortunately, Alice, I want to invite you to share more about it. But does anyone else on the call want to share their experiences and knowledge about Gloucestershire? Or can we commit, and Alice, would you be happy to share some key links with us for us to share with colleagues on the call? So I'll just wait. Can people pop their hand up if they have background awareness on this model? Rachel, did you have some? I'm just trying to. No, I can't see any hands up. So Alice, if you could just pop in the chat to check you're happy with that. It is mentioned in the Creative Health Toolkit, and that's on our website as well, on our Creative Health pages. And one of the speakers showed a snippet from it earlier as well. And Alice, would you be able to commit to share another link on it or something? Oh, yeah, there's an offer. Alice is offering to do a whole session about the consortium work. Would people find that of use? Please pop it in the chat and we'll go back to it. And based on the interest, we've got 2 thumbs up, 3, 4, 5. Okie doke. That's going up. I think that's probably a yes. Thank you, Alice. And thanks, Amelia's put the link to the Creative Health Toolkit there for us. Okie doke. So we've been exploring some of those areas around freelance and long-term contracts. I was really interested to hear, just from our background, the areas that Mel highlighted around the partnership skills and the importance of navigating, and the top tip about using expertise. And I think that's fundamentally Martin's role, is how we're trying to use expertise to speak the different language. And it's almost like Martin's our translator into the cultural sector. So that really resonated with myself, but I wonder if other colleagues have got any examples that they'd like to share around that element of partnership between the different sectors when in relation to creative health. So come on, don't be shy, don't leave me hanging. I know someone's thinking, oh yes. And the lovely, was it Catherine that was from Harrogate? Would you like to share examples? Because I know we've had a lot of creative organisations that have shared, but was it Catherine and Wendy in particular that were from non-cultural organisations? I'd be keen to get your views on that. and have the presentations today resonated? Catherine, I can see you there. Would you like to come off mute?
Yeah, so it was very interesting about talking different languages.
Mhm.
So I kind of have two hats on because my background was in nursery work, but I did some work with Theatre Hullabaloo. I know Benny isn't here today, but I was involved in some of their very early work around the Let's Play project that they did. Then I moved over to health full time. So I'm not a creative myself, but I've been within that organisation. So understand that we come from completely different perspectives. Health's very much, we want the data, we want the evidence, which totally understand, but sometimes you have to be a little bit brave because the projects are right in their infancy and we don't have that evidence based. But if you're working with the organisations that are on here today that have got a long history of the work they've done, perhaps sometimes we have to trust them as the experts that we are going to get the outcomes that we're looking for. But I think sometimes, particularly in health, that silo working is very much, we're driven, the latest priority comes up, it changes. We know the health workforce is on its knees. So I'm part of the health visiting team. And in the area that I work at the minute, their staffing's at 50%. So they don't have time to think of the nicer things that are going on and how these projects would really help some of our families. So I think there's something there actually, when we're talking about long term for people wanting job security and resilience. We need to look at commissioning longer term, but the government with their 4-year terms need to also think where creative arts could come in, because I'm very much for, if we work with those families from pregnancy, early birth, all the way through, we're going to save money in the longer term because it helps so many of the issues that we've got around that parental bonding and attachment. We know 4-year-olds that are creative and go to cultural museums, for example. I tried to get my families into museums and one went, why on earth would I take my child there? I never went. They're not going to go. But when you talk to them that could actually protect their mental health at 11 and then into adulthood, they're like, really? So it's all those conversations we need to have, but we need those experts coming in, and perhaps health can handhold in. So my families went to that museum because I went, come along, you'll be all right. But yeah, there's conversations to be had there. So we find that common ground like Martin provides.
And I think that takes me back to your first point on your slides. It's not a nice add-on. And I'll bring Wendy Kelly in a moment, but just to, when we're thinking about that and we're thinking of the collective action that we want to take, if we're taking collective action, what are the elements around language we need to be, all those different worlds that we're coming from that we need to be cognizant of? So thank you, Catherine. Wendy, are you coming in on the back of that comment or just another perspective?
Just another perspective, really, Heather. Just to remind everyone, I'm the Public Health Self-Tees lead for children's mental health and a huge advocate of using creative approaches in supporting the mental health of children and young people. And I suppose it's just a practical example of how we've used it in South Tees. So I've got an operational team who work primarily in schools, and they're a very creative bunch, really. They've got a lot of skills and, you know, in a wide range of things from art to creative writing, etc. And you know, I'm really keen that we harness the skills of the team and use them in settings which and interventions which are primarily around mental health. So we have embedded creative approaches in a range of interventions that we do in school, and we don't just do it on our own. We've also developed a range of partnerships locally, and not necessarily with the larger or medium-sized arts organisations. We've created a lot of links with local young artists, and it's worked incredibly well, and we've achieved some really good outcomes. And I think that, you know, I mentioned in my problem statements early on that identifying the benefits of creative health is sometimes a bit lacking in some of the submissions we see for the quiz Drinkwater. awards. But I think it can be done, and it can be done really, really well. So we use a range of metrics which specifically would measure the emotional well-being of children and young people, as well as having some type of creative product that they develop. But because we work in skills as well, they're in a unique position where they can track other outcomes for children and young people. So the impact on attendance, on behaviour, on attainment, which is incredibly important for educational settings. So just really, it's just a shout out for trying approaches, and it can work across the health system. So yeah, that's just my public service announcement for creative approaches, really. And I think that partners around the table today from the youth organisations, I mean, you will know everything there is to know about outcomes and evaluations, but I think that there is a piece of work that we need to do for our education settings as well, and it is going to be a priority, Heather, isn't it? We're going to be working with the network to look at how we can showcase the benefits of those approaches.
And sometimes it's that myth busting as well, isn't it?
Yeah.
People think it's a magic potion, and that Bronya in her research comes from a different planet, but we know that Bronya doesn't. And research and evaluation and all important things like that demonstrate the work we do it needs to be part of everything we do. And for those that don't know Wendy, she is an integral part of the panel for the Chris Drinkwater Creative Health Awards that Amelia will be sharing with us afterwards. And it is a personal sort of journey of hers that she's going on to make sure that creative health, evaluation and impact is integral to everybody in the North East and North Cumbria. So thank you very much, Wendy.
That's a grand vision, isn't it?
It is, but you're going to get there. So fabulous, thank you. And really helpful to have a bit of a balance and the importance of education in there as well, and that importance of local links and assets. And I know that was on one of the challenges as well mentioned earlier. Now I'm really keen, and Amelia, point me in the right direction. I think I'm missing out on Kate, and is it Kate and Cheryl? Shall we have Kate to speak first? Would you like to articulate some of the comments that you've been putting in the chat, Kate, to join the discussion? And then we'll have Cheryl again. Or is Kate without sound? Oh no, there we are. Kate.
I'm not. I'm just putting myself back on.
Welcome. Thank you.
So I work as a freelancer, and I work with primarily small organisations who primarily work with freelancers. And I guess that I'm really interested about how you work with how you get this to work for multidisciplinary organisations. So I think that's why Cheryl and I were kind of having a bit of a back and forth about kind of that if you're multidisciplinary, it's really hard to have a set workforce because it changes from project to project. But I was saying as well that the culture thing is really important, because that's what then cascades out each time. So I primarily work as a creative producer, and I would tend to really focus on that culture thing when I work with a team to build that team. And I know that it's much easier for me if I can cascade that down from an organisation level. So, for example, I work with changing relations quite a lot, and we're really working on developing that because, as Kiz said, that whole organisation thing sets the whole tone.
Can I just ask you to share your definition of multidisciplinary team, and what that looks like? Because instantly, as soon as you say MDT, I'm in a clinic with specific MDTs around it supporting.
Actually, so I guess conceptually it's the same thing.
Yeah.
It's just that when I'm talking about it, it's like rather than you're having different health practitioners, we're having different creative sector practitioners. And we might have academics on a team, so we might have someone who's a theatre specialist, we might have someone who's a writer, we might have someone who's a visual artist, so like actually painting, or we might have a photographer, and they are all different in the same way that you'd have different clinicians. So conceptually it does the same thing.
Thank you, just so we could see that in our mind's eye.
The other question I was about to ask is has anyone done a map of who does what sort of support for creative practitioners? So I know that there's obviously a network going on between people talking to organisations, and I know that that's what Change Your Relations does, and it's what I do, is so you're kind of gradually finding out, and I wondered if that map already exists.
Right, please pop in the chat. And if not, and I know mapping is sometimes one of those things that can take an awful lot of resource and then is usually out of date by the time you've completed it, and it's a bit like the Forth Bridge. But is that one of the things for our collective action that it would help sort of kick off this piece of collective action if we understood that? And could we short circuit some of the resources by sharing what we all knew? So has anyone put in the chat about that?
Alistair's going to jump in rather than chat. Is that all right?
Yeah, please do,
Is
Cheryl.
That's like a massive piece of work, isn't it? But actually, I think what we are all doing, like through our networks of creative practitioners, whatever the label we give, artist, producer, dramaturg, theatre practitioner, I think what's happening, and it's not just creative health either, because we do have multidisciplinary artists and multi-setting artists of creative practitioners. So I think we probably do have that intelligence. I don't think we would call it mapping, but there is conversations I'm having with Von about doing the similar principle around social prescribing and link workers. So there was a presentation recently well, that just said there's a diversity and array, and they're different for these reasons in different places. And I'm not sure whether we'll ever, this might be deficit, like negative thinking, whether we'll ever keep up enough. So if we mapped it this year, like, would that be the same next year? And I think it would be helpful, but maybe the approach that we took in terms of place and types of discipline might need to come, like, factor into that.
But definitely I'm hearing something around share at its very basic level, sharing of information, and how do we map and how are we aware of what's going on either in our local areas as a asset, or as something like some of the national examples for us to share and learn on from. So thank you very much. I'm trying to be good with timing, so we're kind of coming to the end of that first half-hour discussion. I can see, Lisa, you've got your hand up. I'll invite you to talk in a moment. And I just want to speak to the speakers, because I know on the next slide we've got reflections from you. I would like you to think of those reflections in the context of that collective approach. So how do we build the workforce together? What have you heard today? What are the actions? What's the collaborative approach? So can you start to think in your head towards that for the final sort of tail end of this discussion, before I then pass on to Martin. So thank you, Kate. So Lisa, can I invite you to join us?
Hi there. Yeah, I'm just building on Kate's question about mapping. So I run change relations and work with Kate, and
Lisa, sorry to interrupt, just so you know, it's a bit, the signal isn't very good, so I don't know if it's because it's moving as well. If you want to start again, thanks.
Yeah, is that better?
Yes, I think so.
I was trying to take the comfort of my sofa, but I've come back to my
sorry.
kitchen table. So yeah, just building on a point Kate made, Kate and I working together on a proposal that we're going to be putting to the Arts Council shortly about workforce development. That's our own workforce, but then we're also really cognizant of the fact that any time that any organisation like ourselves, but also many of the people present, is developing stuff for their own workforce like that, it potentially has wider value as within the sector. So we are we would do some mapping ourselves as part of that project if it wasn't going to be something that was anyway happening. Probably not. I know people are saying, oh, like the Forth Bridge example, you know, is it done and then it's up to date? I can't imagine that we would do it at that level of sort of academic thoroughness. But we are really, really interested to understand who is doing what in terms of skills development and repair and resilience, but also who has then got training offers around that they are putting outwards. Because I am only ever interested in collaboration rather than competition. I don't, you know, I never want for us to kind of step on people's toes or like take over from other people's expertise. I want to add to add value, you know. So
Fabulous.
just
Yeah, no.
out there that some kind of collective kind of, maybe even if there's like some sort of portal that's developed, like I know there's the newsletter, but maybe a website where it's like for our area, what are all the things people are doing and what are all the offers people have that they might be putting out there externally, not just internally, so that we can complement each other and not repeat what each other is doing.
Fabulous. Thank you ever so much. It was still a bit jerky, but I got the message, and I hope everyone else did. And I think it's that important. I love that phrase, collaboration, not competition. And it's knowing what's available, who's out there, who's doing what, and what the training offers are. So thank you. And the one final observation before I go to reflections on the next slide was in relation to, I thought there were amazing examples that were shared, and some of the vulnerable young people that in particular they work with in Blue Cabin. And I just wondered about the breadth and the same principles, because you would imagine that it would be the same principles no matter which group of young people or communities that you are working with. It just might be a variation on some of the suggestions that were required, and some of the inclusion or the elements within those might differ dependent on that cohort. But it just struck me, we were probably, of all the young people that you work with, we were describing some of the more in a particular area, and I just wanted to make sure that people across a more general approach as well would find these of a value, because I would imagine, yes, you would, regardless, across all communities and with all young people, you'd still need the same resilience for your workforce and same skills, just to varying degree. So I don't know if anyone's got a comment on that or can pop something in the chat so we know if that's the case or if not, and it's fine either way. So please pop that in the chat, how it seems from your view, and we'll just go to our final slide before I hand over to Martin. And we're just going to zip through. Alice, if you can be ready to pop your comment in chat. Kaylee, if you can pop yours in chat as well, if you can. And otherwise, I will start with Catherine. And I've over to you in relation to that collective approach and action.
I think some of the takeaways for me, the collective approach as the non-creative in the room, when we're talking about the nurses going off to uni and getting some creative health experience by working with the organisations, it comes back to what Mel was saying about knowing when your expertise ends and you need somebody else, and it's how health links up with you as the experts to bring that in. And then where Blue Cabin talked about knowing your why, and I think that's what we need for our workforce. We probably all accept that creativity helps, but then don't think through any further. We kind of come to a standstill. So actually having the experts come in and talk at things like our professional forums about why you do your work, because then perhaps it will move up the agenda, and instead of it being all of there's brilliant work happening in certain places, but it needs to spread out, I think, across the northeast. We seem to be very good, Northumberland, Newcastle, perhaps over in Teesside, and then we've got a little bit of a grey area, I feel, around County Durham. So it's kind of those experiences.
Thank you. So I'm seeing for our collective action and our manifesto, it's something about the importance of communicating across the sector about the why, and the importance of introducing at those training levels that awareness of these creative organisations. Thank you. Kaylee, are you still with us? Lisa's, there's people saying they're in County Durham. This is all about different people's views. I know Durham, Martin will have a view on that as well as Lisa. County Durham's there. Kaylee? If I know Kelly's been struggling, so I will be going, I'll jump straight on to Wendy. Wendy, your views, what do we need to include in our collective action, and your reflections, please, in a minute. Twice in one day.
I think Wendy popped off. She had to leave
Oh,
early.
did she? Okay, that's a shame. Thank you, Alice. Alice has put her in the chat, hers in the chat. So I will do that and then go over to Cheryl. So Alice says, I think this discussion shows a need to connect more across the creative health sector, and I'll be happy to organise an event in the new year to share some example from other areas in the country. Okie doke. So that is down to that theme around communicating and sharing. So that's coming through strongly in our collective action. And Cheryl, over to you.
Oh, there's been so much, hasn't there? I guess the things that I'm hearing, and I will share the things that we're not hearing as well. So I'd say there's a lot of talk around like the right kind of support, and that's different for different organisations, different approaches need taken, and we need time to understand that, and that it changes. There's something around maybe learning partnership or learning. There's groups of people that talk all the time, especially in the cultural organisations, because we do that thing that Lisa's mentioned, collaborating to obviously add value. So there's something about learning partnership, but for long-term thinking. Lots of people have talked about what's important to them and why, and it definitely shows how it cuts across health and creative sectors. So I think I've noticed how much goodwill there is around supporting the workforce and references to shared metrics, but I think there's still a bit of work to do in this passion to create time to think and time to understand where we're going. So the things that I noticed we probably didn't talk about as much, but were alluded to, that kind of socially engaged arts practice that happens in creative health, in maybe what different settings. I've already started to think about them kind of solutions about what's needed. Is that like quick illustration of what's really needed, essential in a school setting, in a secure setting, in a youth setting, and then obviously we add to it the layers of being better. So yeah, that's my reflection.
Lovely. Thank you, Cheryl. And you'll see in the chat there, Lisa loves your idea of a learning partnership. And I know the ICB has got a learning platform as well. So I don't know if that's something we can link in with, but the importance of the right kind of support and those different service areas as well that you've highlighted as important. And Cheryl's wondering, can we fund collaboratively? And I know that was one of the challenges, and we've spoken about the challenge and we've spoken about long-term funding. So collectively, how do we come together collectively to get that longer-term commissioning and funding? But we haven't come up with necessarily the solutions around there. So if I just wrap up now, first by thanking everybody and apologise if one person wanted to put their hand up to say, oh, she didn't, and I put that in there. If there's one last thing, whilst I'm just wrapping up, please do pop your hand up, and the first person with the hand up I will invite to have the closing comment. But what we've heard from our practitioners that joined us today, the importance of that communicating, shared language, and learning from other models, a lot around mapping. But is it mapping? Is it knowing what your local assets are, sharing the map of the local assets wider? Is it training that you're already doing, looking at almost like a gap analysis as well? If lots of people are doing training X, like Lisa was saying, we don't want to come in competition, but now we know there's a gap for Y, and that's where we might develop further. Catherine mentioned the longer term commissioning. We have the Gloucester model, the benefit of local links and assets, sharing of information, the important models that might be in our manifesto for a collective approach. Is that how do we get that longer term contract, sort of permanent models for staff members, the sharing of wellbeing apps, induction packs and programs, reflective practice and therapeutic supervision, sharing of mental health first aid. Amelia will give you a plug later. She may have some programs for mental health first aid training for colleagues that want them. Making sure we're looking at items like the creative health quality principles. And also one thing we didn't touch on, but is that importance of how do we deliver at scale and trying to solve that. So no one's got their hands up, but Lisa has popped in the chat, so she's won the closing comment. Oh, and you've even got I don't know how to do that exploding emoji there. Your closing comment, do you want to verbalize it or shall I read it in case you're...
I can say it, that's fine. I know you said before that you reflect that there's an awful lot going on in the Northeast, and that's what I feel when I have these kind of conversations with different people in this room, like individually, but also in these collective forums. And I love that there are so many of us that also have that collaborative mentality of how can we work together, how can we share, rather than just like compete with each other, which, you know, is non-productive. We don't need that list nonsense. So yay, the Northeast.
Yay, thank you. And what a fabulous point to end on. And we love a celebration, and we will have oh my word, they're all coming out now, stars on glasses. So we love that, and I think we've already committed with Alice to do a future event, and it's such a shame that Alice and Kelly couldn't be with us. But thank you to all the speakers that have been with us today: Catherine, Kaylee, Mel, Wendy, Alice and Cheryl. And Cheryl's put me to shame. I'm looking at you walking thinking I should be stood up doing that. So thank you ever so much. And I will hand over to Martin, oh my word, 3 minutes early, to do your reflections, and hand over to Amelia. Thanks ever so much, Martin.
Great, thank you, Heather, and thank you for facilitating the discussion. In many ways, there's not much more to add. I think many people have said, and I don't want to just kind of recycle and repeat things. First of all, is to thank you all for attending. I think just the fact that we had such a high initial sign up is an indication that there's a real appetite around workforce development. And I think, to echo Lisa's point, that in the Northeast, we have a growing sector around creative health and looking at how we can basically improve the health of our region through culture, which is really important. I do, there's a couple of flags to kind of pin, or pins really. I definitely would like to, and I will work with Alice to try and get a conversation where we can talk more about national, because I'm very lucky with, like some other colleagues, to be able to hear about some of the national stories and work that's happening, and it's very interesting, and it's that kind of learning model to find out how others work. I think it's a good reflection to remember that our sector, culture, health, education, it's never static, and it's constantly growing and evolving, and it's trying to keep pace with that. And we talked about a number of pieces of work today, which is mapping, or developing a bit of a manifesto, or learning partnerships. And these are all actually quite vital, and they take time and they take resource. So I think there's a really interesting question for some of us to reflect upon. Who needs to kind of grab it and drive it? Is that Arts Council? Is that the Cultural Creative Health Wellbeing Alliance? Is that the National Centre for Creative Health? Is it the partnership? Somebody needs to kind of just give it more of a shape and a nudge. And I think myself, Alice, and Cheryl should probably convene a conversation around those bits as well, but make sure that's transparent and open and inclusive of everybody as well. So there's a lot there, and there will be more to come, and I think the next iteration will be probably, I'm interested, if people are interested, in a bit of a deeper dive in-person conversation to unpick these a bit more. And with that comes barriers around resource and funding and venue and space. But we can go so far on huddles, but then sometimes you need to get a bit deeper with that. So do watch out for a post-meeting invitation. I don't have a date or a time or a space in my head yet, but I definitely will liaise with a few people and try and keep momentum going actually on that. Would be really important. But yeah, thank you all for your time. And I think I'm also on time to hand over to Amelia.
I failed because I forgot to talk about the Chris Drinkwater Awards. That's on the next slide. That's why it's got stuck there, Martin. So that's the slide. Please encourage organisations to apply for that. It's open now for primary school aged young people that you work with. It's a partnership between cultural creative organisation and an education organisation. The links are in the chat. Thank you very much. And thanks, Carol, for making sure I didn't miss it. And then we're on to Amelia.
Yeah, thank you very much. So I'm just going to share a little bit about what's on the horizon for the network and the different opportunities. So obviously there's another huddle in the in the offing, so we'll plan that, and more information, as Martin said, will come out in the near future. So keep an eye on Child Health Tuesday. So can I have the next slide, please, Carol? As ever, we are really keen that you look at our Healthier Together app and website. So the link, the second link that Heather's put in, sorry, the first link, which is the QR code, that'll take you to the Healthier Together website, and that takes you specifically to the Chris Drinkwater Awards. However, there is a whole host of information that can be used by yourself as professionals, but also for the families that you work with. And in particular, key example is a page that I use quite regularly with my friends. Should my child go to school today? And it's a fabulous resource for families just thinking, you know, is my child actually well enough? And it takes you to all the other pages that give a lot more details about lots of other conditions. So I highly recommend having a look at the Healthier Together app and the website. So moving on. There's the QR code that's available. And yeah, this is, I guess, the important bit about communicating, engaging with the network, which is what Heather referred to in the initial introduction. So we have our weekly Child Health Tuesday bulletin. So hopefully you all receive it. And if you don't, please do sign up to receive it. We have our newsletter, which comes out. And if anyone would like that reshared, we can put it, because it came out earlier in the summer, we can reshare that. We are on X at EveryChildNENC. And then we have our system engagement group, which has gone through a bit of a refresh. So in our most recent Child Health Tuesday, there was an invite for our network members to join the system engagement group. And it's all about how do we reach different communities, organisations across the region and address sort of those issues that come up. So this might be a topic that you want to discuss in there. We talked about our Huddles programme. So we've got our Nature and Health Huddle coming up. And we've also got our Huddle with Bronya and the Voice of Babies in November, which we're really, really looking forward to. We've got a whole range of different reports and resources, including the Core 20+5 toolkit, cost of living resources, and again, they're all hosted on our Healthier Together website. And there's lots of different toolkits and support to help promote the Healthier Together app and website, if that's something that you'll be interested in finding out more about. So next slide, please. And because we'll share the slides with you, there's all the links there. We've also, I haven't mentioned our network of networks. So if you work with groups of young people, we have our Youth Voice network. So if you'd like to join that network, please, again, do get in touch with the main inbox. And we share Youth Voice opportunities, and that can be events, surveys. Monday, it was I shared about a voice survey around patient records. And if also on the flip side, if you've got opportunities that you want to share with groups, please do get in touch. And then we've got our professional networks. So there might be networks that you're involved with that you can register on there. And then next slide, thank you. We're just keen that you stay in touch. And Heather has shared our main email inbox, so please do get in touch if you have any further information. And I think that's our last slide. Oh, and there's a QR code to join. Yep. So thank you very much. And Heather, would you like to close the session?
I suppose just to say thank you both to yourself, Amelia and Carol, who are the behind the scenes sort of team that get everything done, and often the unsung heroes. So thank you ever so much, and a huge thank you to Martin as our arts and creativity advisor, because without him he wouldn't be able to, well, he wouldn't have pulled us all together, and I've found it really invaluable and look forward to the next steps. I think it's great to have the discussion, but the important thing is we go to the next step with it. With that collective action, and let's do something positive for the young people in our region. So thanks ever so much, everyone. Thank you.